This is Dr. Epstein. I'm with a patient, a very nice patient. Let me just film her procedure. Remain confidential, of course. It's for surgical hairline advancement. She's a great candidate. Her hairline's around 14 centimeters above the nose. The goal is to get the hairline forward by at least 4 to 4.5 centimeters, hopefully even 5 centimeters. As I marked out, here she is. She's got wonderful scalp laxity, and you can see by when I push down my fingers, you see how far I can advance her hairline. Now, once I do some what we call these galeotomies, which loosen the scalp, I'll even be able to hopefully get it at least down to here, and ideally down to around here, which is a nice point because that's where her vertical forehead meets up with her horizontal scalp. The way the procedure is done is I make an incision. You can see I've marked out the incision. I sort of ignore these baby fine hairs because these are basically worthless. And the incision is going to be made right along here and along the sides. And then what I do is I lift this up and then I bring it all the way forward. I then secure it, and then I'm able to excise at least this much, which, as I said, is around 4 centimeters marked out, hopefully around 5 centimeters. 4 centimeters is a little over 1.5 inches. Procedure is done under local anesthesia with oral sedation. I can do it under twilight or intravenous sedation, but most patients are fine without it because I'm able to basically achieve anesthesia with 2 tiny injections in the forehead. Anyway, she's a great candidate. The surgery itself we're about to undergo it. It takes around 2 hours total, and she will look presentable 2-3 days later with stitches along the hairline, but most of these patients are used to covering up their hairline anyway. They either wear their hair forward or they wear some type of head covering. So anyway, she's a great candidate, and we're going to film her when we're all done. Anyway, this is Dr. Epstein. Thank you very much.